Thank you.
Real help starts with the DuPage County Crisis Recovery Center, where support is available 24/7. When you or someone you care about is going through a mental health or substance use crisis, it's easy to feel overwhelmed and unsure of what to do next. Whether you're facing an urgent need or just need someone to talk to, the DuPage County Health Department team is here for you. Call us or walk in. No appointment is needed, and we're ready to help when you need us. The Crisis Recovery Center serves youth ages 5 through 17 experiencing a mental health crisis, as well as adults 18 and older facing a mental health or substance use crisis. Children under the age of 5 can receive an immediate assessment and may be connected to community providers for ongoing support. When you arrive at the Crisis Recovery Center, you'll be welcomed into a safe, supportive space by a compassionate team trained to handle mental health and substance use crisis. A calming place where you're respected and secure. We can create a personalized plan that meets your needs, whether you need short-term support, someone to talk to, or long-term resources. We provide crisis counseling, peer support, medication management, and withdrawal management services if needed, as well as linkage to ongoing community services. Seeking help takes courage, and it's a sign of strength. Whether it's the middle of the day or the middle of the night, we're here to listen, to support, to help you move forward. Real life brings challenges. Real help starts with the DuPage County Crisis Recovery Center. Call 630-627-1700 or walk in 24/7 at 115 North County Farm Road in Wheaton, Illinois.
Good morning and welcome to DuPage County and the DuPage County Crisis Recovery Center. My name is Sam Tornatore and I'm the president of the board of the DuPage County Health Department. Thank you all for being here. On behalf of the DuPage County Board of Health, it's an honor to welcome you today as we celebrate a major milestone for public health in DuPage County. After many years of thorough planning, collaboration, and execution, we're introducing you to the DuPage County Crisis Recovery Center this morning. The opening of this facility is the final step in a decades-long journey to revolutionize behavioral health care in DuPage County. This morning, you will hear from just a few of the many people who have made this day possible. You'll learn about the new level of care, which we'll soon be able to provide, the team of behavioral health professionals who will provide it, and the people we will help in their greatest moment of need. And yes, the beautiful building behind me where it will all take place. But to take a step back, I believe that the new Crisis Recovery Center is a statement about who we are as a community. that when someone, anyone in crisis, they deserve immediate, compassionate care, and they shouldn't have to jump through hoops in order to get it. As many of you know, the need for accessible behavioral health care has never been more urgent. Families across DuPage County and across the country are increasingly struggling with mental health and substance use challenges. Too often, the systems meant to support them are confusing, delayed, or out of reach. We often talk about public health as being about prevention, access, and equity. This center embodies all three things. It will save lives, it will remove barriers, and it will demonstrate that in DuPage County, no one will face a behavioral health crisis alone. Again, thank you for being here this morning to witness this milestone. Thank you for all the roles that you've all played in making this happen, and thank you for continuing to stand with us as we move forward together. And now I'd like to welcome to the stage the person who in many ways, figuratively and literally, helped build the foundation for this crisis recovery center when she was in the legislature, our County Board Chair, Deb Conroy.
Thank you, Sam. I'm so pleased that you and I are celebrating this moment together. Your dedication and support as Health Department President has been essential to this project. I'm grateful for your efforts and your friendship. Well, this is a great day in DuPage County. It's a great day for those of us who dreamed big and worked hard, all of you. We knew that we could create a gold standard for community mental health and substance use care right here in our own backyard. We dreamed of a place where there was no stigma, where everyone was welcome and where people in crisis could start their journey to healing, including and especially our children. But even I didn't dream that the resulting building could look this good. Thank you, Drayson Dwyer and White Construction Company, for exceeding our expectations. Back in 2019, as chair of the Illinois House Mental Health and Addiction Committee, I heard from families in need from all over the state. Families and individuals suffering from the impacts of mental illness and addiction that needed diagnoses and treatment that they can access and afford. Together, my colleagues in the legislature, please stand, so many of you who are here today. We responded to that urgent need. They helped me secure $5 million to help fund construction of the state-of-the-art facility that we intended to be the model for our region, our state, and our nation. Now in DuPage County, those who seek help for mental health or addiction crises have someone to call, someone to respond, and most importantly, somewhere to go. A tremendous thank you to my colleagues on the DuPage County Board who heard and felt this need. You came together and unanimously allocated more than $15 million to build this center. Your support will change lives. Please stand. I want to welcome our mayors, township, and other local elected officials. I want to thank our emergency responders, police, and firefighters who knew long before anyone else that taking individuals to jail or even the emergency room wasn't the best course of action for our friends and neighbors in crisis. We thank you for your input and partnership as we work toward a better way to get people back on the path to health and stability. When you bring the right people to the table, amazing things can happen. I think Dwight and company, Jason Dwyer, didn't just come to the table. He and health department staff jumped on a plane to see other centers around the nation. We learned what other centers were doing, and we learned what we could do better when this facility was built. And boy, did they deliver. Today, a new dream begins. Today, I ask you to join us in changing lives. Take a tour. Most importantly, tell your friends about our state-of-the-art recovery center. The more we talk about mental health and addiction, the more we break down stigma and make it easier for people to seek treatment. Let folks know that what they need is right here. Everyone is welcome, youth and adults, insured or uninsured. Medicaid users welcome. No judgment, no stigma, no noise, just healing. And it's right here in our own backyard. Now that is something to celebrate. When I say putting the right people at the table is the most important thing that we can do, and we've done that, I'm really happy today to have Lindsay LaPointe, who is the chair of the Mental Health and Addiction Committee. She took off where I left off, and she's taken it to the next level, and I'm incredibly proud she's here with us today.
Wow. DuPage County, Chair Conroy, the board, my colleagues from the Illinois General Assembly, this is such an exciting day. And I see tears in people's eyes, and they're tears of joy, but they're also tears because most of us have experienced some level of crisis, or a loved one or somebody we know or care about. We've needed this for so long, and so I feel that joy and I feel those tears of relief. I'm so happy to be here today with you in DuPage County as we unveil a vital, life-saving resource, the Crisis Recovery Center, that frankly we need in every corner of Illinois, and we're optimists, so we will get it in every corner of Illinois. We will get it. I'm here in part because I'm proud to carry Chair Conroy's torch as the chair of the Illinois House Mental Health and Addiction Committee. And I'm grateful that we have some DuPage County legislators on those committees. And they're not all here, but I still want to name them. We have Rep. Tara Costa Howard, who's on the House Mental Health and Addiction Committee. Rep. Michelle Mussman covers a little bit of DuPage County, and then we have Senator Karina Villa, a former school social worker who's on the Senate Behavioral Health Committee. And they are all here in spirit, and Tara, I see you, my seatmate. But I'm also here because affordable and accessible behavioral health care is a top priority for me. And we need that for everyone in all forms. And when I say behavioral health care, I mean mental health, I mean addiction, I mean recovery, I mean harm reduction, and I mean trauma support. And when I say all forms, I mean prevention, mental health screenings in public schools, peer support, talk therapy, crisis intervention, which is what we have here, and psychiatric treatment, and that's just to name a few. We have come such a long way from the days of stigma and isolation and psychiatric treatment being the main form of our response to people suffering from mental health crises. You have all come a long way in DuPage County from the days of 911 or jail or just a hospital being the only response. But I also know, you know, that we still have an incredibly long way to go until we have quality crisis response for anyone who needs it in every corner of Illinois, no matter the time of day. But here in DuPage, you're leading the way. You're lighting a path so the rest of the state can follow you. I want to take a moment to talk about just how life-saving public awareness can be when it comes to mental health and a crisis response. And that's one of the reasons why I'm so heartened that there are so many people here. Back in June, in the district I represent on the far northwest side of Chicago, I was at a local police district council meeting, and I was giving a presentation on mental health and policing. And there were only about 25 people there, but as part of the presentation, I asked the group, how many of you have heard of 988? Raise your hand. And about a quarter of them did, which was okay, not great, but okay. And then when I asked how many people know who the mobile crisis responder is, or know what mobile crisis response is, period, or who the provider is in our area, nobody raised their hand. Absolutely nobody raised their hand. And so that reminds us all that crisis response cannot be just a phone line. I love it that more people know about 988, but that is just the beginning. It's a three-pronged approach. And we must stay laser focused on public awareness. So just like Chair Conroy said, talk about this. We can't assume that everyone in DuPage County knows about this. When we build out the entire system, it is going to be a three-pronged approach, and we are getting there. So number one, 988. We need a place to call, and we do have it, that everybody knows about. And not quite everybody knows about it yet. We need somebody to come, and that's the mobile crisis response, and everybody has to know about it. Not everybody knows about it yet. We need a place to go, which of course here in DuPage is now going to be the CRC, and it can't just be jail, it can't just be a hospital. That's not where people heal, and everybody has to know about it. None of it works if we don't do the public awareness and talk about it with our friends and family and everyone, everywhere, in every zip code in Illinois. And in some places like DuPage, you have it. And in other places like Southern Illinois, or even where I live in Chicago, we don't have a place to go that's not jail and the emergency room. Old habits are really hard to break. We all know that. We're all human. And for decades, we have all been calling 911 for mental health crises. For decades, first responders have been the main people responding to mental health and addiction crises. For decades, police and fire have been dropping people off at lockup or at ill-equipped ERs. And those habits are going to die hard, even in places here where you have a beautiful new building. So keep up the PR, keep up the media coverage. That will save lives too. One final thing I want to touch on is the amazing frontline behavioral health workers that will continue to offer this life-saving support. None of this will happen without the frontline behavioral health support workers. And there's a truth about those folks, no matter where you are in Illinois, and that is we have tended to undervalue and underpay our frontline workers. These are folks with graduate degrees, like many of you have, like I have, with clinical licenses, like Lori Carnahan has. Many of us have student loans. And I do know that DuPage is leading the charge, and you've got those higher salaries, as they should be. But in many parts of Illinois, you can have a clinical degree, you can have a master's in social work, you have student loans, and you get a job, and you're earning just about $40,000 a year. So to those folks, those frontline workers, I want you to know you have allies in Springfield. The decisions that we make are directly tied to making sure that every county in Illinois can have a frontline workforce. It's tied to Medicaid reimbursement rates. It's tied to adequate health and human services budgets. So we're going to keep fighting that fight in Springfield for you. You're going to do the incredible life-saving work here, and we're all going to do it together until we have a place to call, somebody to respond, and a place to go in every single corner of Illinois. And two key people in that, before I turn it over to Lori Carnahan, and these folks are here today. We have Director David Albert from our Office of Behavioral Health and Recovery, and in Illinois, we have a Chief Behavioral Health Officer, and that's Chief Inger Burnett Ziegler. We are so proud to work with you. You are a part of this too, and so we're all going to make the change across the state together. Yes, we are. So now, it's my pleasure to introduce you to someone many of you know, Lori Carnahan, who's a huge leader in behavioral health in DuPage County. And Lori shows up in lots of spaces. This is not my first time meeting her because she does work that affects the entire state of Illinois. DuPage County is so lucky to have her. Thank you, Lori.
Good morning. I am so happy to be here with all of you today. Looking at this crowd, seeing so many people that have put their time, their energy, and their resources to make this a reality is absolutely amazing. This is a truly transformational moment. The opening of the DuPage County Crisis Recovery Center marks a milestone not only for our county, but for the entire state. This moment is deeply personal to me. I began my career as a crisis worker, meeting people in their most vulnerable moments, helping them find safety, hope, and a path forward. Oftentimes, those interventions were done in an emergency room or in a local police station because there was nowhere else to go. Those experiences never left me. They shaped my belief that we can and must do better for people in crisis. For the past decade, I've dedicated my work to transforming the way our community responds to crisis. And today, standing here with all of you, I see that transformation becoming a reality. For too long, people in need of crisis care have faced a fragmented system. Access depended on the time of day, your age, your insurance, or what type of crisis you were having. That's not care, that's chaos, and people in crisis deserve better. We needed a place where anyone, at any time, from any background, could walk through the door and find safety, stability, and support. And now that place exists. The Crisis Recovery Center will meet people exactly where they are, whether it's a youth struggling with depression, an adult facing a mental health emergency, or someone overwhelmed by substance use. Our team will be ready to provide immediate assessment, stabilization, and connection to ongoing services. With compassion, with professionalism, and with urgency. Because in crisis, every minute matters. This is the first of its kind facility to bring a youth and adult services together, to bring mental health and substance use together, all under one roof. We are proud to be eliminating barriers and simplifying access to life-saving and life-changing care. But we did not do this alone. The work it took to get to this moment reflects the power of collaboration. It took strong community partnerships with local police and fire departments, school districts, hospitals, and many community organizations. These are often the first people to encounter someone in crisis, and we are so grateful for their continued trust and support. This milestone was also achieved because of DCHD's leadership and staff, who turned a bold idea into a reality with vision, determination, and so much heart. And it became possible because of the people of DuPage County whose support and openness to innovation made it possible to reimagine what crisis care can be. This is what happens when an entire community comes together, all committed to building a better way to care for people in crisis. Today's a day to celebrate, and it's also a day to look ahead, to carry this work forward with determination and purpose. Because the opening of the center isn't the finish line, it's the start of something new, a new standard for crisis care and renewed promise that no one in DuPage County will ever have to face a behavioral health crisis alone. Real help starts here. This is where the recovery begins. So thank you for being here, for supporting the vision, and for being part of something that will change lives for years to come. All right, so with that, I'd like to introduce the Executive Director of the DuPage County Health Department, Adam Forker, who has been a wonderful support and a leader in helping us get this building open.
Wow. Okay, thank you all so much for being here this morning. It's really an honor to share this moment with so many leaders and friends from every corner of DuPage County. Everybody played a role in making the Crisis Recovery Center come to life. As you've heard, today marks a new chapter for behavioral health care in our county. Moving forward, when someone in our community feels lost or overwhelmed, they will have a place to turn. A place that is compassionate, a place that never closes its doors, a place that offers hope. I'm deeply honored to be a part of this vision, a vision to help build the healthiest community possible. So to our elected officials, our local leaders, our community partners, thank you for your ongoing support. And to the extraordinary staff at the DuPage County Health Department, it's your belief in this mission made today possible. Your dedicated service to our shared community inspires me every day, and from the bottom of my heart, I thank you. And a special thank you to Lori Carnahan and Kathy Carey and the Behavioral Health Leadership Team. Their steady guidance, their vital contributions to this important work is incredibly meaningful. We want to support every person who walks through these doors and make sure they feel seen and heard, to know they are not alone, that we understand their challenges, and that we will walk with them through their most difficult moments. The center will be for our neighbors, our friends, our loved ones, for anyone who needs it. And finally, I want to take a moment to recognize our two remarkable leaders on the stage here whose dedication made all of this vision we've talked about become reality. So please join me in acknowledging DuPage County Board Chair Deb Conroy and Health President Sam Tornatore. Thank you so much. We would not be here without you. Okay, so that's it. Thank you again for being here, sharing this moment with us. We will officially cut this ribbon. We're going to welcome everyone inside for the first time to the DuPage County Crisis Recovery Center. So, a little bit of housekeeping logistics. I'd first like to ask all Board of Health members, county board members, and state representatives to proceed to the front of the CRC. We're going to do the official ribbon cutting photos. And then immediately following that, tours will begin. So everybody should have gotten something that looks like this, a tour card. Everybody else, you're going to wait for your color to be announced. Then you're going to proceed for your tour. We have a lot of guests here today, which is wonderful. So this will be ongoing for the next hour, the 10, 15 minutes. You're in great company. Enjoy each other's company. Grab some water. I will see you inside. Thank you once more.